Let's talk about understanding care versus residential occupancies. And so when you go through this particular flow chart, when you're asking these critical questions, it's really going to help you determine what am I? Am I a C, a B2, or a B3? Or am I a retirement home? Right. And these healthcare by a regulated professional. So that's one, administering of drugs, help with feeding, bathing, dressing, hygiene, walking, or continence, providing meals, or any other service designated as a care service by regulation. Facility who require special care because of cognitive and physical abilities. And I think you'll notice in our particular questionnaire we have, that's a question about, it's a particular building that's going to be helping certain individuals. It's not that typical single family home, but you can tell that there's some type of service. It's open. It's owned by a company, and they're allowing people to stay there, elderly, and they were dying in some of these retirement homes and because of fire and smoke inhalation. And so, really, the big thing that the building code added was to then have this category called a retirement home. Here, we're at a critical decision to be made. If we drop down to C, okay, that could be it. Or we're maybe going to we're still in B. So it's almost like you're in B, and then once we answer these questions, you drop down to C, and then there'll be further questions on the C once we get there. Because that really helps us understand when we have a care and treatment. And so it really distinguishes between the B2 and the B3.